What if I told you, the way you've been taking care of yourself for decades, the habits, the little routines you've done without even thinking, could now be quietly working against you? I mean it. You might think, I've been doing this since I was a young man, it's always been fine. But here's the truth nobody talks about: once you hit your 60s, your body isn't the same machine it used to be. And if you keep treating it like it is, you could be setting yourself up for discomfort, frustration, and even long-term damage you never saw coming. Now, I'm not here to scare you. I'm here because too many men, good men, find themselves feeling less confident, less in control, and less connected to their own bodies, simply because no one ever pulled them aside and said, "Hey, it's time to adapt." And listen, I know how personal this is. I know this isn't something you chat about over coffee with your buddies. This is private. This is about you, your health, your confidence, your manhood, and I'm going to treat it with the respect it deserves. I'm Dr. David Jarrard. For over 30 years, I've been helping men navigate the changes that come with aging, changes to your circulation, your nerves, your hormones, even the way your body processes touch. I've worked with men who felt like they were losing something they thought they'd never lose, and I've shown them that pleasure, connection, and vitality are not just possible after 60, they can be even better. But only if you understand what's really going on inside your body, and make a few important adjustments. Because here's the thing, self-touch is not just about pleasure. It's about keeping your circulation strong. It's about protecting sensitive nerve endings so they don't fade away over time. It's about safeguarding your confidence, your mood, and yes, even your prostate health. But the habits that worked in your 30s can quietly chip away at all of that if you're not careful. And that's why this conversation matters more than you might think. So here's my promise to you. By the end of this video, you'll know the 5 most common mistakes men over 60 make when it comes to self-touch, the safer, healthier techniques that protect your body and your pleasure, and the 4 clear signs that mean it's time to speak to a doctor. You'll walk away with knowledge that could change not just how you experience intimacy, but how you protect your long-term health. Before we dive in, I want you to do something for yourself. Drop a quick "I'm here" in the comments so I know you're part of this conversation. And if you're ready to take control of your health, your pleasure, and your confidence for the years ahead, make sure you subscribe to Golden 70s Health. This is the place where men over 60 get the real, respectful, and honest answers nobody else is giving them. Let's start with the first mistake I see far too often, and it's one that sneaks up on you without warning. I once worked with a gentleman in his late 60s, fit, active, took pride in staying healthy. But over time, he began to notice something troubling. After moments of intimacy with himself, he'd feel a slight soreness. At first, he brushed it off, told himself it was just age catching up. But that discomfort became more frequent, and eventually, even the pleasure itself started to feel muted. He thought it was something he just had to accept. But he was wrong. Here's what was really happening. As we age, the skin along the shaft of the penis becomes thinner and more sensitive to friction. The tiny blood vessels that feed that area become more fragile. And when you keep using the same firm, intense grip you've used for decades, those vessels can become damaged. The nerve endings, the ones that make touch feel so alive, can start to dull. That means not only more discomfort now, but a slow decline in sensation over time. And yet, the most common reaction I hear from men in this situation is, "Well, I'll just push harder." They think, if it's harder to feel, I just need to grip tighter, move faster, or add more pressure. But the truth is, that's the opposite of what your body needs after 60. What once felt good in your 30s might now be causing micro-damage that's stealing sensation from you in the long run. So here's what I tell my patients, and what I'm telling you right now. Loosen your grip. Not halfway through, but from the very beginning. Think about holding yourself with enough contact to connect, but not enough to strain. Let your skin, your nerves, and your circulation work with you instead of fighting against you. Focus on sensation, not force. You might be surprised at how much more you feel when you're not overpowering your own nerve endings. And remember, this is about preservation. About keeping the sensitivity you have now so it's still there for you in the years ahead. Because grip isn't the only thing that changes with time. There's another factor that can make all the difference, and that's your pace. Mistake number 2, starting too fast. Let me paint you a picture. A man I once counseled, 72, sharp as a tack, loved to keep busy, told me that when he was younger, he could go from 0 to full speed in seconds. And for decades, that's exactly how he approached self-touch. Quick, intense, focused on the end goal. But lately, he said, it felt different. He was putting in the same effort, but the pleasure wasn't as sharp. Sometimes it even felt confusing, like the signal wasn't getting through the way it used to. And that's exactly what was happening. As you age, your nervous system slows down. The touch signals from your skin take a little longer to travel to your brain, and your brain takes a little longer to process them. When you start fast and aggressive, your brain simply can't keep up. It's like turning on a song halfway through the chorus. You miss the build-up, the anticipation, the richness of the experience. But here's the misconception: so many men think, if I go faster, I'll feel more, and I'll finish quicker. But for a nervous system that's slowed with age, fast movements can actually overwhelm your senses. Instead of giving your brain time to enjoy and interpret what's happening, you flood it with too much, too soon. The result? Flat, muted pleasure. Or no pleasure at all. So here's the adjustment. Slow down, not just a little, but intentionally. Think about building a rhythm that lets your body catch up with your mind. Imagine tuning an old radio. You don't spin the dial wildly and hope to catch the station. You turn it slowly, carefully, until the music comes in clear. The same principle applies here. Start slow, let your body recognize what's happening, and allow the sensation to deepen before you increase the pace. You may discover layers of feeling you haven't noticed in years. Now, slowing down is a huge improvement, but there's something else that can quietly sabotage all of your efforts. And it has nothing to do with speed or grip. It's something far more basic, and most men over 60 don't even think about it until it's too late. Mistake number 3, skipping lubrication. This is one of those things most men never even think about. I can't tell you how many times I've heard a patient say, "Why would I need that? I've been fine without it for decades." And maybe you have, but your body changes with time. In your younger years, natural skin oils and moisture gave you a bit of built-in protection. After 60, testosterone levels drop, and one of the quieter side effects is reduced natural lubrication in men. Combine that with thinner skin and more delicate blood vessels, and dry friction becomes a recipe for irritation. Micro-tears, redness, or even delayed soreness you don't notice until the next day. Let me tell you about one gentleman, 68 years old, proud of never needing any extras. But after a few months of dryness and discomfort, he came in thinking he had an infection. Turns out, it was just friction damage. Simple. Avoidable. And easily fixed with one small change. The misconception here is that lubricant is only for women, or only for partnered intimacy. But that's simply not true. Lubrication is about protection, not just comfort. It allows your skin to glide instead of drag, it reduces unnecessary strain on your nerve endings, and it helps your body interpret touch as pleasure rather than irritation. So here's my advice: use a gentle, unscented, water-based lubricant from the very start. Not as an afterthought when things already feel rough, but right at the beginning. Rub it across the entire area, not just one spot. Give your skin a chance to soften and warm up to the sensation. You'll notice the difference immediately: smoother, safer, more responsive. And once you've got your grip, your pace, and your comfort handled, there's another trap that many men fall into. It's not about how you start. It's about how you think you're supposed to finish. Mistake number 4, forcing climax every time. This one is tricky, because for most of your life, climax was the definition of success. It was the goal. The finish line. The proof that the experience was worth it. And for decades, that mindset worked just fine. But here's the thing, after 60, your body plays by a different set of rules. Your arousal might rise and fall in waves. It might take longer. It might surprise you by fading halfway through, only to come back later. And that's normal. I remember talking to a 70-year-old man who was frustrated because he couldn't finish every time like he used to. He thought something was wrong. He tried pushing harder, moving faster, tensing every muscle to force the outcome, but all that did was make him tense, sore, and discouraged. What he didn't realize was that forcing climax triggers your body's stress response. Stress hormones like cortisol can shut down arousal completely. The harder you try to make it happen, the more your body resists. The misconception here is simple: if I don't finish, I've failed. But self-touch isn't a race, and it's not a performance. After 60, it can be more like a massage or a slow walk, an experience to be enjoyed for what it is, without needing to tick a box at the end. So here's the shift: let go of the stopwatch. Let your body lead. If climax happens, enjoy it. If it doesn't, that's okay too. If you feel satisfied halfway through, or want to pause and come back later, you're not doing it wrong, you're listening to your body. That kind of patience can bring back sensations you thought were gone, and it can make the times you do finish feel richer and more satisfying than before. But there's one more mistake I see far too often, and it's the easiest to slip into after years of habit. It's when you stop paying attention to your own body's signals. Mistake number 5, ignoring your body's feedback. This is the silent one, the mistake that creeps in after years, even decades, of doing things the same way. You get so used to your routine that you stop noticing the small changes. Maybe something feels a little dull. Maybe there's a new spot of tenderness, or a patch of skin that's more sensitive than it used to be. Or maybe the pleasure just doesn't feel quite the same. And instead of adjusting, you push through. You tell yourself, it's fine, I've been doing this forever. But here's the truth, your body is talking to you all the time. That little twinge of discomfort. It could be your skin telling you it's had enough friction. That sudden loss of sensation. It could be your nerves asking for a break. That unexpected rush of pleasure in a different spot. That's your body inviting you to explore something new. I knew a man in his mid-60s who ignored a growing numbness for over a year. By the time he came to see me, the nerve irritation was far more advanced than it needed to be. If he'd simply paused, adjusted, or changed his approach when it first started, we could have avoided months of recovery. The misconception here is dangerous. If it doesn't hurt badly, it's nothing to worry about. But small signals are your early warnings. They're your chance to make changes before a small irritation becomes a lasting problem. So here's the tip: treat every self-touch session as a conversation with your body. If something feels uncomfortable, stop. If something feels good, stay with it. If you notice something different, pay attention. You're not just going through motions, you're exploring, adapting, and protecting what matters most. And speaking of protecting what matters, there's one final piece to this puzzle. It's not a mistake, it's a mindset shift. The difference between seeing these changes as a loss, or seeing them as an opportunity. Now, let's talk about the mindset shift that changes everything. For most men, aging feels like a slow list of things being taken away. Energy isn't the same. Recovery takes longer. The body responds differently. And when it comes to intimacy with yourself, those changes can feel personal, like they're somehow a measure of your masculinity. I've heard men say, "I just don't feel like myself anymore," or "I guess my best days are behind me." But here's what I want you to know, those thoughts are not the truth. What's really happening is that your body is evolving. It's asking you to meet it where it is now, not where it was 30 years ago. And when you do that, something surprising happens. The experience changes, but it doesn't become worse. In many cases, it becomes better. When you let go of the pressure to perform exactly like you did in your 20s, you open the door to a different kind of pleasure, one that's slower, deeper, more connected. You start noticing sensations you used to rush past. You feel more in tune with your breathing, your heartbeat, your own rhythms. It stops being about racing to a finish line, and starts being about enjoying the journey. Think of it like switching from sprinting to walking through a beautiful park. When you sprint, you're focused only on the end. When you walk, you see the details, the light, the colors, the air on your skin. Self-touch after 60 can be like that. Less about the clock, more about the connection. This shift isn't just about technique, it's about respect. Respect for your body's needs today. Respect for the years it's carried you. Respect for the fact that it can still bring you joy, release, and comfort, if you care for it in the way it deserves. And here's the best part, when you approach self-touch with this mindset, you protect your body, you protect your health, and you protect your confidence for the long term. You start living in partnership with your body instead of pushing it against its limits. Now that we've covered the mistakes to avoid and the mindset to embrace, it's time to talk about something just as important, knowing when it's time to get help. Because while many changes are normal, there are moments when your body is telling you it needs a professional's attention. Let's talk about the 4 signs you should never ignore, the moments when self-care needs to include professional care. Because while many changes are simply part of aging, some are signals that your body needs extra support. And catching these signs early can make all the difference. Sign number 1, persistent pain or discomfort. If you notice a sting, dryness, or burning sensation during or after self-touch, and it doesn't improve when you use a gentle technique and proper lubrication, it's time to pay attention. This could be inflammation, a small infection, or tissue irritation. These are common, and they're treatable, but if you ignore them, they can worsen and lead to bigger problems down the road. Sign number 2, sudden or worsening numbness. A gradual change in sensation is expected as you age, but if you experience a sharp drop in feeling, or an area that feels completely unresponsive, that's not something to shrug off. It could point to a nerve issue, and the earlier it's addressed, the better your chances of full recovery. Nerves can heal, but they need time. And timely action. Sign number 3, difficulty getting or keeping an erection, even in calm, private settings. We all know that erections can take longer as the years go on, but if you find that even in a relaxed, stress-free moment your body just isn't responding, this could be more than age. It might signal a blood flow issue or a hormonal imbalance. Neither of these is a reflection of your masculinity. They're simply physical systems that may need a tune-up, and a doctor can help you get there. Sign number 4, emotional distress linked to self-touch. This one is often overlooked. If the experience leaves you feeling anxious, ashamed, frustrated, or disconnected, that's just as important to address as any physical change. Emotional health and sexual health are deeply connected. Talking to a professional isn't a sign of weakness, it's a sign that you value yourself enough to take action. Here's the bottom line, you don't need to wait until things are bad to ask for help. Even a short conversation with a urologist can bring clarity, reassurance, and practical steps you can take right away. You deserve answers, and you deserve to feel confident in your own skin. Now, let's bring everything we've talked about together, the mistakes to avoid, the mindset to adopt, and the signs to look out for, so you can move forward with confidence. I know these changes can feel frustrating. Sometimes they can even feel a little scary. When something you've done your whole life starts to feel different, slower, less intense, or harder to achieve, it can stir up doubts you didn't expect. But here's the truth, ignoring these changes won't make them go away. Pretending nothing's different doesn't protect your health, and it doesn't protect your confidence. What does? Adapting. Listening. Learning how to work with your body instead of against it. Your body isn't failing you. It's not broken. It's simply asking for a different kind of attention now, one that respects where you are in life, and what your body needs today. And when you give it that attention, you open the door to a kind of pleasure and connection that's richer than the fast, hard, outcome-focused experiences you had decades ago. So here's what I want you to do: try just one of these adjustments tonight. Maybe it's loosening your grip. Maybe it's slowing your pace. Maybe it's adding lubrication from the start. And when you do, notice how your body responds, without judgment, without pressure. Don't measure it against what you used to do. Just be present for what's happening now. Because pleasure after 60 can be deeper, calmer, and more satisfying than you remember. It can last longer, it can feel more connected, and it can bring you a sense of peace that's just as valuable as excitement. The key is giving yourself permission to experience it differently. You've earned the right to enjoy your body without rushing it, without forcing it, and without worrying if it's the same as it used to be. Every stage of life has its own rhythm, and this one can be every bit as fulfilling, if not more so, when you lean into it. Before we wrap up, I want to ground everything we've talked about in clear, medical understanding, so you know this isn't just opinion, it's backed by what we see every day in urology. In my practice, and according to the guidelines from the American Urological Association, sexual health in older men is closely linked to overall vascular health, nerve health, and hormone balance. That means the same small blood vessels that supply your heart and brain also supply your penis. If circulation is reduced, sensitivity and performance can be affected. If nerve pathways slow, response time changes. And if hormone levels shift, desire and recovery times adjust accordingly. These aren't signs of failure, they're predictable, natural changes. Now, every body is unique. If you have conditions like diabetes, heart disease, or nerve disorders, your experience may be different, and you should always talk to your doctor before making any changes to your routine. These conditions can affect blood flow, nerve sensitivity, and skin health in ways that make safe adjustments even more important. It's also worth remembering that certain medications, blood pressure tablets, antidepressants, and even some over-the-counter remedies, can subtly change how you experience touch. They might slow arousal, make it harder to maintain an erection, or slightly dull sensation. None of this means intimacy is over for you. It just means you may need to adapt your technique even more, or discuss alternatives with your healthcare provider. The point is this: knowing how your body works now, and how your health conditions and medications affect it, isn't just smart, it's empowering. When you understand the why, the how becomes much easier. And that's when you can protect your sensitivity, your comfort, and your confidence for the long term. So, let's bring everything together. To recap. Loosen your grip so you protect your skin and nerve endings. Slow your pace so your body has time to fully process and enjoy sensation. Use lubrication from the very beginning to keep friction safe and comfortable. Release the pressure to climax every time and allow yourself to enjoy the experience for what it is. And above all, listen to your body. Those small signals are your early warnings, and they're worth paying attention to. And if you notice any of the 4 signs we talked about: persistent discomfort, sudden or worsening numbness, ongoing difficulty getting or keeping an erection in calm settings, or emotional distress tied to intimacy, don't ignore them. That's the time to see a urologist. Getting clarity and support early can make all the difference for your health and your confidence. Now, I'd like to hear from you. Which of these points surprised you the most? Was it the role of lubrication? The importance of slowing down? Or maybe the idea that climax isn't the only measure of success? Share your thoughts in the comments below, because your experience could be exactly what another man watching this needs to hear today. If you want to keep your body strong, responsive, and healthy well into your 70s and beyond, make sure you subscribe to Golden 70s Health. Join thousands of other men who are taking charge of their health, learning how to adapt, and living life on their own terms. Stay strong, stay informed, and take care of yourself with the respect you deserve. And I'll see you in the next video, where I'll reveal one overlooked habit that could silently affect your prostate health. Trust me, you won't want to miss this one.